Hi everyone, I'm going to talk about imaging techniques for in vivo imaging. I'll use rodents as example, but the techniques are same for big animals or humans. Why do we use rodents for studying human diseases, especially so many mice? First, mouse and human have more than 95% genes in common. It means you can introduce in a mouse many human-like diseases like cancer, cardiovascular disease, Alzheimer's, and so on. And you can use these animal models to develop either therapies or study the mechanism of the disease, especially for imaging application. You can develop new imaging tracers to detect or monitor the disease much better. Second, mouse has a much faster metabolism than human. We can study the full course of disease in few weeks or months instead of many years in human. Last, genetically modified mice allows researchers to study disease mechanism in more detailed molecular level. The traditional approach for animal research is usually invasive or must be conducted ex vivo. In this example, there are three study points. One is disease onset, and then disease progresses and introduce therapy, and then researcher will monitor the therapy efficiency. So the question is, how many euthanize or sacrificing time points for traditional approach in this case? Yes, answer is 3. At each time point, one group of mice must be sacrificed to check the disease progress or medication efficiency. It's impossible to follow the disease progress over time on a single animal. On the contrary, one uses small imaging techniques. So these are the same animals, the same group of animals is studied over the entire length of the study, significantly reducing the total number of animals to be used, and only the last time point is the sacrificing point. So in this example, traditional way, you need 24 animals, and in vivo image is only 8. In vivo imaging can help with reducing the animal numbers and refine the way experiments are carried out. During imaging, animals usually don't feel any pain or discomfort. And the comparison, traditional techniques are low throughput and time consuming. Yeah, we have talked about the advantages of in vivo imaging. There are many kinds of modalities. Researchers need to choose the most proper modality according to the research questions. The most common techniques are ultrasound or CT, MRI, optical imaging, and PET or SPECT. I will only talk about ultrasound and MRI. These two are the imaging techniques actively in use in our institute, but soon we will also install a combined PET MRI imaging system as well. First, I will talk about ultrasound. I will explain a little bit of physics with the examples and mostly in cardiac application. But before we start, please keep these two questions in mind. What does ultrasound use to? produce images and how to interpret an ultrasound image. 50 million years ago, bats already started to use ultrasound to catch prey. It sends out sound waves. When the wave hits the prey and bounces back, the bounced back wave, also called echo, is in blue color. Bats use echo to decide the location of the prey. And more recently, in World War One, Army used ultrasound techniques, send in the wave and bounce back the echo for detect the submarine or the submarine to detect the fishes. Scientists also find that ultrasound can be used to image the inside of the body. The probe here to emit and receive ultrasound wave is called transducer. This is show the patient is having ultrasound on heart, which have a special name called echocardiogram. Echocardiogram is a special term for heart ultrasound. And this is the ultrasound machine we use for imaging mice and rats in our lab. We have mentioned ultrasound use waves. Now what a wave shape like? It looks like this. And the wave repeats itself. There is an important term we need to know. That is frequency. It is wave number within 1 second, or how many times wave repeat itself per second. And the unit is hertz. For example, if the frequency is 50 hertz, then it repeats itself 50 times in 1 second. So this is repeat itself much often. It is high frequency. And this is repeated itself less often. This is called low frequency. And high frequency usually have higher pitch, and low frequency have lower pitch. Human hearing can only catch between 20 to 20,000 hertz sound. This is a YouTube video. You can search it yourself. It's a hearing test. So when you're getting older and older, you lose the ability to catch the high frequency sound. And the higher frequency it is, the higher pitched sounds. The ultrasound uses over 2 million hertz frequency, which is way out of our humans' capacity to hear it. So let's assume you have a neighbor, have a loud party. You can close the door and the noise but still comes through the wall. Have you ever noticed the sound from the neighbor is usually bass sound, but not clear? So this means it's the low pitch sound where you hear, or low frequency sound, because low frequency sound, they has the property of more penetration, so it can penetrate the wall to your room, but less resolution. It's not that clear. On the contrary, if you hear music by headphone, its high frequency sound is very clear and nice, but the bass sound is difficult to make it clear. So high frequency waves has better resolution but less penetration. Now I will explain how ultrasound transducer make images. This is the ultrasound transducer. it sends ultrasound waves and hit on the two material. One is hard material, the other one is soft material, and bounce back. Because this one soft material is closer to the transducer, so it bounce back first, and this hard material is further away, so it come back later. And this hard material, they bounce more echo back, and the softer material bounce less echo back. To make an image, the transducer determines the two things from receive the echo. How long it took the echo to be received from when the sound wave was transmitted and how strong the echo was. Once the ultrasound scanner determines these two things, it can locate which pixel in the image to light up and to what intensity. So it's sending waves and listen to see how strong and how long it took bounce back and send again and listen. So how to read an ultrasound image? The images consists of pixels with different gray levels. Bone is the hard material and gives the strongest signal. The fluid reflects and echoes list. It shows black, and the tissue lies in between. So the more ultrasound wave reflects, the brighter signal is. This is an eye ultrasound. As we can see, this retina gives the strong signal and the fluid is black. So these are two heart images. Please take a look which heart is normal. Yes. To the left, a normal heart with normal contraction and relaxation. To the right, the heart visually has normal contraction, but it shows thick walls here compared to the normal heart. It is stiff and substantially it relaxes slowly. So since it relaxes slowly, it's difficult to feel it with blood. Sound wave has a cool effect called the Doppler effect. That is when the sound moves towards the detector, in this case, it's a human, the frequency will show the higher frequency, so it will sound more high pitch. And if the sound wave moves away from you, it will show the low frequency. So for example, this is ambient. When it approached with the siren blasting, the siren sound was high pitch and it was high frequency. When it passed by, the pitch was lower. That was the Doppler effect. It's a shift of apparent frequency for a sound wave. This property is using ultrasound image. So these are the two transducers and the sending certain frequency ultrasound wave. When the blood flow towards the transducer, the echo bounce back appears higher frequency. And when the blood flow away, then the frequency appears lower. Doctors use ultrasound to image flows. So left is a homogeneous blood flow. and the right is turbulent blood flow because of plaque. The same principle can also be used to measure the movement of myocardium. So this is the movement of tissue, and this is the movement inside of the heart, the blood. So let's summarize what we have learned about ultrasound and answer the questions asked before the session. So first, what does ultrasound use to produce images? Ultrasound imaging uses high-frequency sound wave to produce image. How to interpret an ultrasound image? The signal intensity order is bone is the brightest, and then tissue, and then fluid usually is dark. And the last 2 points are high frequency sound wave is better image quality, but lower penetration, and the low frequency sound wave penetrate tissue better. So ultrasound can measure both tissue and blood movement.